We want to move immediately and swiftly into our final panel session of the morning. And that is going to be a discussion on driving breakthrough innovations in maternal health with digital tools, data, and private sector collaboration. And this is going to be brought to us by MSD for Mothers. I'm going to introduce one lady, and she is going to give a few remarks and introduce the rest of the panel. But Kenya is a land of champions. We are a country of champions. So I call it the champions round of applause. Have you ever seen in Olympics or an athletics event, when the long jumper is about to run, they start slow and then they ramp up the rounds of applause until it reaches a crescendo and everyone's screaming. So I'm going to introduce her, read her very short profile, and then we will welcome her along with that round of applause. All right, so when I do that, we should start the slow clapping. Is that okay with everyone? It's okay, you can shout back at me. Is that okay with everyone? All right, let's go. So, Jacqueline Caglia is the head of MSD for Mothers and is a director at Merck for Mothers, where she oversees strategic communications, learning and evaluation, and US programs for the global effort to end preventable maternal deaths. She brings more than 2 decades of experience. Oh, start slow. Start slow. There we go. She brings more than 2 decades of experience in public health with deep expertise in maternal health, health equity, and multi-sector partnerships. Her earlier roles include Associate Director of the Women Health Initiative at Harvard T.H. Chan School of Public Health, and she holds an MPH from Boston University. Ladies and gentlemen, with a massive round of applause, welcome to the stage, Jacqueline Caglia.
Thank you, Karaganya. You said you were going to do some special clapping. I didn't realize how special it would be. What an amazing welcome. Well, good morning, everyone. It is such an honor to be with all of you gathered here in Nairobi and everyone joining us online from around the world. My name is Jackie Caglia, and I am part of the team advancing social impact and sustainability at MSD. And part of my role, I have the distinct honor of leading one of the world's largest public-private partnerships ever, focused on improving maternal health outcomes and making lasting improvements to health systems. And that is our MSD for Mothers initiative. Several years ago, in partnership with many of you in the room and some of the folks you'll hear from today, we launched an initiative called Strengthening Systems for Safer Childbirth through a $25 million commitment to locally led solutions in India, Kenya, Nigeria, and Sierra Leone. This was not like any previous commitment. This was truly a commitment to collaboration and an investment in digitally enabled solutions aimed at addressing challenges within maternal health that have been stuck for years. As you'll hear about some of these solutions today, please think of the people and the providers at the center of each. I'll ask you to focus on a woman in a remote village in India, happily yet anxiously pregnant following several challenging pregnancy losses, who isn't yet receiving regular prenatal care. I'll ask you to think about a woman in Nigeria who just had a baby 2 months ago, who isn't quite feeling like herself following a recent diagnosis of elevated blood pressure. I'll also ask you to think of a country-level healthcare leader here in Kenya, a county-level healthcare leader here in Kenya, trying to make difficult decisions about the best interventions to help bring down preventable maternal and newborn deaths in their community with limited budget resources. These are the types of cases that we've been seeking to have an impact on, so that every pregnancy and childbirth is a chance to connect to healthcare that is safe, high quality, and respectful, and so that we can truly together deliver on health systems that actually improve health and well-being for all. So please join me in welcoming to the stage Natasha Sundarji, the Global Health and Nutrition Lead of Accenture's Social Impact Practice, to lead the conversation along with the panelists. Thank you for having us here today.
Good morning, everyone. Let's try that again. Good morning, everyone. Wonderful. Thank you so much for joining us for today's discussion. It is a conversation that is near and dear to my heart, as I've had the great privilege of working alongside the MSD for Mothers team for over 10 years now, and I've had the chance to work with the Strengthening Systems for Safer Childbirth team for the past 3 years. And today I am joined on stage by a brilliant set of individuals who represent teams that are doing incredible work to improve the health of women in key markets, including India, Nigeria, Sierra Leone, and Kenya. These individuals represent organizations that are at the cutting edge of digital, data, and AI. And together, we hope to have a dialogue that builds on the conversation we've been having over the past 2 days, really focusing in on how they've really been leveraging digital and data. How has their solution evolved over time, given that this technology is so fast changing? And staying at the cutting edge requires a tremendous amount of effort and learning on a day-to-day basis. We also want to talk about how they've been able to scale their solutions over time, how to make them truly sustainable, as we know that that is one of the biggest challenges with all of the digital health work that we are all doing. And last but not least, we hope to have a candid conversation around the learnings, be very open and transparent around where they're struggling and what we can all learn from these conversations as we look to their solutions, as we reflect on the journey that they've been on, and as you reflect on your own individual journeys. So let me do some quick introductions. So at the far end, we have Siglinder McGinney. She is a strategic health systems leader with over a decade of experience driving impactful international development programs in Kenya, and she currently leads Jacaranda's health systems strengthening department, overseeing their maternal and child health initiatives. Round of applause. Next to her, we have Chiagozi Abiakan. She is a seasoned clinical pharmacist who has worked in a variety of healthcare roles, including providing clinical pharmacy services, enhancing patient safety, and leading healthcare projects. As she is currently a manager of women's wellness at MDoc Healthcare. Round of applause for Chiagozi. And last but not least, to my left is Dr. Jatinder Nagpal, who is the Deputy Medical Director and Head and Consultant of Pediatrics at Sitaram Bharatiya Institute of Science and Research, and brings over 2 decades of experience in pediatrics and medical research. Round of applause for Dr. Jatinder. All right, Dr. Jatinder, I'm going to start with you. Perfect, you have a mic. So Dr. Jatinder is part of a coalition of actors called ISATI. And ISATI is partnering with state governments in India to support over 20,000 women in their maternal health journeys. And through their innovative AI chatbot decision support tool, ISATI is really empowering women and healthcare providers, starting in Assam but have expanded since then, to really provide autonomy in reproductive health, enabling self-care, and improving access to quality maternal services throughout pregnancy and postpartum. Dr. Jatinder, over the past 2 days, you had a chance to even showcase your chatbot to many of the S3C innovators, and it was great to see the ways in which you've leveraged AI technology. Tell us a little bit more about that journey. How did you realize the value of engaging women through a digital chatbot? How did you start to learn about AI? How have you integrated AI into your platform?
Well, when we started more than 3 years ago, the chatbot was giving what is called structured periodic responses, in the sense that messages were being sent at a periodic interval to mothers who were enrolled in the first trimester and subsequently continued up to 15 weeks postpartum. What we realized was that these messages, one, were very uninteresting, so as to say, because the mother could not ask questions. The other element was that the messages which were being sent and the entire sequence which was being played out was very, very sequential. It was, just a periodic sending of messages as per gestational age. As we started to look at AI as a possible solution to this problem, we started to incorporate what is called contextual chatting. And in this, we were able to utilize what is called natural language understanding. Here, there were questions which the mother was able to ask in our particular language or the particular local language, and the chatbot or the AI processing was able to understand why or what this question meant, because many of these questions were incomplete. It then subsequently read into a repository of structured messages which is called contextual chatting. And now we are working on what is called retrieval augmented generation, and it is going into the phase of natural language generation where she could get the response directly in the context of the language that she has asked the question, and thereby solve the issue or whatever problem she's facing in a more comprehensive and better way.
Wonderful. What I love about this is that it really focuses on giving mothers, giving women information, empowering them, giving them the right tools to ask questions and engage them. And Chigozi, this makes me think of the conversation you and I were having yesterday when it comes to the great work of Project Aisha. So just for some context, Project Aisha, the consortium that Chigozi is working within, are working to reduce maternal deaths and complications in Lagos and Kaduna by tackling what we call the 3 delays. So that's the delay in seeking care, that's the delay in receiving care, and also it's the delay in receiving adequate care at the facility. So Project Aisha has been working directly with healthcare facilities to empower healthcare providers, really institutionalize improvement systems at the facility levels, and strengthen engagement with women and their communities. And it's that last piece that I think links so closely to what we just heard from Dr. Duchinder. Talk to us about Project Aisha, the ways in which you've used data from both the facilities as well as women in order to create this comprehensive solution to improve quality.
Thank you so much for that question and a very wonderful introduction of Project Aisha. So yes, Project Aisha is transforming maternal health through sort of like bridging the gap between women's lived experiences and how the health system responds to their experiences, right? Thank you very much, Dr. Titania, for your response. Just building on, the engagement with women through a chatbot and just really double clicking on understanding their context, understanding their lived experiences, and actually drawing those insights. So I'll give you very briefly 3 key ways we're leveraging technology. 1, integrating women's voices, right? So we're leveraging MDoc's NaviHealth.ai platform to collect open-ended feedback on women's care experiences and their quality of care. So they're allowed to express themselves from waiting times to how excellent the facility was, to like little problems like mosquito bites, right? We are also collecting structured feedback, leveraging an adapted version of the 6 quality of care dimensions, right? And then we're feeding that back into the system and helping facilities have targeted support. The second way we are leveraging technology is actually just transforming quantitative and qualitative data into actionable insights, right? So ensuring patient-centered care and that relevant stakeholders have access to synthesized data that they can use for evidence-based initiatives. And then finally, we're leveraging digital to build capacity of healthcare workers. Just imagine creating a digital learning platform, virtual mentoring platform that enables continuous quality improvement, peer-to-peer support. It allows us to engage multiple healthcare workers simultaneously, but also allows us to extend care beyond Project Aisha sites and facilities. And I'll just pause here.
Wonderful. There's 2 points that you mentioned there that I want to pick up on. And Siglinder, I might bring you into the conversation at this point. For context, Siglinder is working on the coalition called KQE, or Kenya Quality Ecosystem. It's a public-private coalition that partners with the Kenyan Ministry of Health as well as county governments to connect evidence-based maternal and newborn health solutions with funding and data. And so you can already imagine the points I want to pick up on that Chiagozi rightly highlighted, which is feeding information back into the system and this idea of capacity building. Talk to me a little bit more about the data collection that you've been doing and how you've been using that data to build capacity, particularly with the Ministry of Health and the county governments and the power of that data to transform systems.
Thank you, Natasha, and thank you to my panelists. So as Natasha has introduced, I lead the Kenya Quality Ecosystem Project. We are implementing with Ministry of Health and in 3 Kenyan counties. When we started the project, our North Star was around how can we provide county governments with the right data and use data as their North Star towards decision making on improvements in the health system. And we quickly saw that there's an opportunity to use digital to enable that. So how we've been applying digital in that front is one, around simplifying data collection tools that our health system actors use to collect data that helps us understand what are the key gaps that exist in facilities that are impeding access to quality of care for our mothers. And then secondly, we've employed digital around then summarizing and visualizing the data by aggregating all of this data we are collecting and also data that exists within these counties and visualizing it on dashboards so that health systems actors can have access to dashboards that are really quick to understand, really quick to generate insights, because we know the health system is complex and data can be a really good pathway for empowering health systems actors to prioritize and see where to put resources. So for us, we've really been leading the way in terms of data can be the solution for how health system managers, county executives prioritize where to put investments and also understand what are the biggest gaps that exist in terms of improving quality of care for our mothers. And this is our contribution towards improving the health system as the coalition.
There's 2 points I want to highlight in what you just said. One, health systems can be very complex, and tackling the many challenges that might exist in the healthcare system can sometimes feel overwhelming to the healthcare stakeholders that are responsible at the ministry level, at the facility level. And this is where the true power of data comes in. But it's not just data. It's the ways in which that data is presented and the visualization work that you've done and the very simple digestible dashboards that you've created have been so powerful in your work, in your solutions, and in your ability then to engage government stakeholders to channel resources to the right areas to address quality needs. Being mindful of time, I promised that we were going to have a more candid conversation about the challenges that these coalitions have faced and how their solutions have evolved over time. One of the most brilliant things about the Strengthening Systems for Safer Childbirth program and the MSD for Mothers team's approach is they found coalitions that had complementary capabilities and brought them together and gave them funding for 3 years and said, go experiment, go fail, go learn, and just focus on where you can have the greatest outcomes. So these organizations had the great opportunity to experiment, to fail, and to learn. And your solutions have evolved over time as a result of that. Talk to us about the ways in which your solutions have evolved based on those learnings. And let's start with Siglinder at the end.
Thank you. I think when we started implementing our project, given that this is a strong data-focused project, we realized that the challenge is not availability of data. Actually, the challenge is creating pathways for utilization of data. So how our solution has evolved over time has been around understanding what are the challenges that exist within, county departments of health, facilities, and sub-counties that are impeding the use of data. So over the last 3 years, we've learned a couple of things, and one of the things that we did right early on was the concept of co-design. I know this word is thrown around quite a bit, but true co-design.
What are you going to say that's different about the co-design that you do?
I think the co-design that we do that is different is we actually go to the stakeholders. We go to facilities, we go to sub-counties, we go to county health boards and sit with them and understand when it comes to data utilization, data visualization, what is it that you really want to see? What key data points do you want to see? And then use that feedback and create a product that then they give feedback on. So we've had a lot of engagement across all the stakeholder levels, and then presenting a product that they can actually see, give feedback on, and then use their feedback to sort of improve the process. And I think supporting data utilization does not end at core design only. It's also thinking about how can we use mechanisms that exist within the health system to support data utilization. So some of the things that we've done over the last 3 years is consistently going back to counties and doing data review meetings. For the Kenyans in the room, you know, our counties have mechanisms like data review meetings, monthly data review meetings. So it's plugging into those spaces to support data utilization and to also support, you know, the tools we are designing to make sure they're embedded within the structures that exist in counties. And I think that's been one of the ways that we've been able to grow our solution and see that counties are using the data that we're putting in front of them, and at all levels. So we don't just go to boardrooms, we also go to facilities and go to sub-counties. And I'm sure other countries are structured differently. So just thinking about how can we make sure we're involving all the stakeholders on the health system to support this idea of data utilization. Thank you.
So I'm going to stay with you for a second here, because we often talk about co-design, we often talk about engaging multiple different types of stakeholders. But even within a stakeholder group, we have to recognize that it is not a homogeneous group. So let's take that example of county government stakeholders. That includes multiple different types of stakeholders. And yesterday, or maybe it was day one of our conversation, we talked about the importance of engaging at multiple different levels of government, not only because they have different needs and all need to buy into solution, but it also provides you with a level of resiliency to your solution, because we know stakeholders move around. It provides you with a level of sustainability to your solution. Pick up on that point. What have you seen as you've engaged with different types of government stakeholders at different levels? Are their needs truly distinct? Has the messaging you've had to use with them evolved based on their level, based on what their respective asks are?
For sure. I could respond that by just saying yes to what you've said. But yes, I think one of the incredible things that has happened over the last 3 years is we've been able to understand how needs differ across different levels of stakeholders. So for example, a facility level nursing manager will need more granular data that shows her, in your particular facility, the gaps exist first, maybe in SOPs, the gaps exist, you don't have a stethoscope, the gaps exist in infrastructure. As you go higher levels up, the stakeholders higher up need less granular data, more summarized data that they can look at the health system in a more bird's eye view compared to the lower level stakeholders. So I think, we've had to evolve and understand the needs of the different stakeholders and then change our messaging. And also I think one of the things that we've done even on our dashboards is have different access levels for stakeholders. So what a facility manager will see should be different to what a county executives should see, because their needs are quite different in terms of digesting the data and the decisions they need to make. Yeah.
So I'm going to come to you on this point, Chigozie, because we had a really interesting conversation around this data access point and the importance of privacy and some of the challenges and learnings that you've had on data privacy. Maybe you can read folks into that conversation that we had and the challenges that you experienced and how you've been thinking about data privacy.
Thank you so much for that question, and thank you so much, Saklinda. I feel like you sort of like really talked about, you know, some of the challenges we experience as well implementing, right? So yes, we've had data privacy challenges as well as data access challenges, right? And like you said, implementing in a big ecosystem like Lagos with over 339 active primary healthcare facilities, 29 secondary facilities, and over 2,000 private facilities. Understandably, our stakeholders had concerns about who has what access to what data, right, across different levels, so facility levels, health district levels. How do we help, you know, support them around that? And then during our co-design, we just realized that a one-size-fits-all model is not going to work for this. So we now, you know, step back, you know, try to now understand what their needs were, and then implemented a tiered access approach where access was provided based on roles and jurisdiction, right? So what's your role and what level of data do you need? How granular do you need that data to be? And depending on the districts or LGAs as we call it, right? You have access to relevant data for your district, right? So some of the learnings that we've gotten from this is around how important co-design is, right? You need to bring in stakeholders very early on and really understand their needs, because that really creates the ownership, right? If they understand that they are part of this solution and this solution is designed for them, then from the get-go, they take ownership of it. Another key learning is that privacy and trust is a prerequisite, right? You need to get them to actually trust. And in trusting, it's not just communicating data security, but also demonstrating through these tiered approaches that you have implemented data security. And I'll pause here.
So let's build on this point of trust. And Dr. Jitendra, I'd love to bring you into this conversation, because when you are engaging with women and young girls on these topics, sensitive topics, ensuring that you have trust is such an important part of your solution. How do you do that? What challenges have you experienced as you've tried to build that trusted relationship so they feel safe to share their challenges, their questions, and get the right response and the right level of support?
So, in healthcare, one of the challenges that we face is that whatever response you are giving cannot be 95% accurate or can't be 90% accurate, because 10% error is too big an error. And one of the ways in which we attempted to resolve this is to have each of those responses and structured sentences vetted by experts and women ambassador panels, so that the cultural and the contextual meaning of those sentences is something which is deliberately preserved at the end of the user. The second element that we tried to do is to have each of these common questions listed. Like, what are the mothers actually asking, and what would be the meaning of those questions that she's asking? And then to be able to translate that on the basis of existing guidance and guidelines, in which we look deeply into what those responses should be, and then look at the context of what the response should be in the sense of what it would mean as an answer in that cultural context. So preserving all of that truth at the last level of the patient or the user was probably the most difficult part, and that is where the most important challenge lay.
I'm going to come to the audience and take a couple questions in just a moment. So this is a cue to get your questions ready, but I want to pick up on this point. It's not enough to just have a response to a question. You have to understand the meaning of a question. In practicality, how do you do that?
So what we did was that we created a list of questions that were being asked spontaneously by mothers to the chatbot. The cultural context, the meaning of that in that particular language, because verbatim translations sometimes don't carry the meaning. The exact meaning of that particular context was denoted, re-verified by women from the same community, so that we understood what those women might have been asking. And this was fed back into the machine learning AI system, that, okay, this is not the best response or best understanding that you have generated, and it was trained to be able to interpret the questions in a natural language understanding kind of model, that the meaning is not missed. And that, if the question is wrongly interpreted, of course, rest of it, totally gets destroyed in AI. So that was something that we diligently proceeded, and it was an exercise over, I think of 3 to 6 months, that this itself, in terms of verification of options, in terms of verification of exactly how the AI is interpreting what has been asked, was done.
So I promised to come to the audience, and I want to make this truly a dialogue. We do have some roaming mics around the room. If folks with the mics can raise their hands so that we know where to go. Wonderful. Any questions from folks in the audience? If you don't mind raising your hand, we'll do our best to identify you. Please make them questions. Introduce yourself, the organization you're coming from. We'll probably do 3 questions. We'll take them all together, and then we'll turn it back to the panelists to respond. Go right ahead.
Okay. Thank you so much. I actually wanted to pick on Nneka Mobisen from MDOC, part of this beautiful consortium. I actually wanted to pick up on what Dr. Chichenze, what you highlighted around a 10% error rate is not allowed in our context. But if you think about it, in practical clinical care in our settings, depends on where you are, that error rate could be even 50%. So I'm just curious, just across all three of you, because across all three, you're leveraging AI, and how are you thinking about that? Is it an unfair standard that we're holding ourselves accountable to? In our low and middle income country context, is that really fair? How should we really think about it? Do we need to, do we need to do anything differently, or do you think we should really hold ourselves to this standard, or reframe and re-educate the people we serve and our stakeholders?
Great question. We'll take two more. I see a question here.
Yes, good morning. My name is Noimot. I'm doing my PhD in communication, digital health communication. So I wanted to ask, when you were talking about the privacy and the need to be able to humanize digital care, the question is, now when we look at privacy from the position of implementers, what does privacy mean to the users? Because for someone like my husband, I like voice notes. He doesn't like voice notes because he's a 90 person and he sees, it's an opportunity for people to mess you up. So now, privacy is different for me and for him. So how do you begin to look at privacy and all of the other principles of humanism when it comes to digital health, when it concerns the users? How are users interpreting privacy and all of those concerns, ethical considerations, and what does that mean to you as implementers? Thank you.
Another great question. One last question.
Natasha, all the questions are coming from the front, and it seems like there's 17 and not the 3 that we asked for.
I feel like all the folks that are well caffeinated are sitting towards the front and therefore asking all the questions.
All right, good afternoon. My name is Rachel Motuku and I work with Girl Effect. From the previous panel, one of the panelists talked about AI being a means to an end and not an end in itself. And he talked about the importance of looking at the outputs or the outcomes. So my question is, the value of the visualization of data is, we can see, it's key. But I'm curious, as we talk to the policy makers, the governors, the leadership, do we triangulate and complete the story beyond showing the tools and the importance of the data the tools is collecting? Do we show the impact and the outcomes? Are we able to draw that picture so that they can see the completeness of what the tools do or what they support? Thank you.
Fantastic set of questions. All right. So first and foremost, we're going to talk about, are we creating an unfair standard for ourselves? The second thing I would like us to talk about is privacy. How do we think about the privacy needs of different individuals? And then how do we think about privacy as organizations and implementers? And then last but not least, this idea of moving just beyond data to the story behind that data and the impact and the outcomes and how that then shapes your narrative and the conversations you then have with stakeholders. I'm going to do, just maybe for the sake of time, we'll say, you're going to take the AI question on the unfair standard. We're going to go to privacy with Chigozie, and then we'll jump to you at the end to talk about the storyline.
Well, thank you. So, with reference to error rates, I would highlight what is at stake here. We work typically in a public health system with permissions from the government and probably in a complementary, supplementary sort of way to what the existing health system is trying to deliver. Many times we are not only under scrutiny by the patient, by the care provider, but also by the health system, right? And any message which is at conflict or contradictory to what they are trying to teach their healthcare providers like the ANMs or Anganwadi workers in our particular areas, that has connotations which are well beyond that one error message that was delivered. It is often used as an example to kind of browbeat the entire success story, which might otherwise be very, very significant. So which is why I said that we probably need to have unrealistic targets in the context of error rates in this particular sphere. While it is, probably human error takes over in healthcare very often, but at the same time, if we are trying to provide a solution, targeting the best accuracy is probably the best strategy.
So, in a world where trust is so important when it comes to the data and digital solutions, we probably do need to hold ourselves to a slightly higher standard in order to get the buy-in and sustainability behind our solutions. All right, Chigozie, privacy. How are you thinking about the different privacy needs of different individuals that you are engaging with, and then privacy as an organization driving these solutions?
Okay, thank you so much. So in my previous response, we talked about how we had to consider privacy across like the facility level, the health system level, so that they trust the work and they understand that we understand them and we work for them, right? In terms of the women and how the patients and the end users actually view privacy, so our work is mainly in low to middle income communities, right? So we realize that communication is key. They really need to understand the impact of the solution and what the solution is about. That understanding really, really helps. And I'll give you an instance. When we started implementing, right, collecting reviews, we only got positive reviews and then maybe neutral only, right? So we realized that re-education needed to happen. They needed to understand why these reviews were important and how it benefits them, right? And then that education started happening on both the facility level. So the facility doesn't see it like, oh, we want to talk bad about your facility. No, they see it as a tool to improve and provide better care and even generate more income in the long run, right? And then the patients see it as a way to get the best from the facility when they go. So that education and communication happened. And guess what? We started seeing more negative reviews and more reviews that really fleshed out women's pain points. And then guess what, right? Women started talking and sharing their care experiences and their pain points. And I'll give you an instance. There was this facility that, the woman had shared concerning reviews around her experience, right? In today's age, still getting slapped in the facility. So she detailed it down and put it on Navi Health. And, that review was escalated. The MD wanted to know, okay, so how did this happen? What happened, right? And she was engaged, but she was too scared to hurt the healthcare worker that did that to her. So she had shared her review, but did not want to, indict anyone, right? So that's another level of education. So yes, you've shared, but it's not about the indictments, it's about the learnings that come from it and the continuous quality improvement that actually comes from it. So during review collection, you are given an opportunity to leave an anonymous review, right? Or leave a review with your name on it, right? So that way, the patient and the member is in charge of who gets to see their review, if they want to be talked to about it afterwards, and how far they want to take it. And I'll just pause here.
So providing a level of optionality around what you share to allow people to engage how they choose. 1, 2, providing data in bite-sized pieces so people can understand the value and then ask for more. And then 3, I think you should follow up with her, is how then they've thought about the data internally within their own organization, who gets access to what, is a really important part of that story, because it's not just about the stakeholders you're engaging with, it's how we as organizations treat the data itself, because this is private data. It doesn't need to be accessible by everyone. Let's talk about that last question, translating data into stories and the impact and how that then changes how individuals engage with you and how they then transform health systems.
Yeah, I'm going to try answer this question by sharing a candid example that I absolutely love that has happened over the course of this project. So when we went to one of the counties, I'm not sure I can mention the county, but when we went to one of the counties, this county had one operating NBU. It also had another NBU that was fully equipped with equipment, all the machines, but the NBU was not running. So in the course of doing our data work and our data analysis, we realized the challenge here was the NBU, even though fully equipped, it wasn't running because they didn't have the nurses required to run the NBU. So in one of our data review meetings that I mentioned earlier is we were able to tell a story to this county and say, look, babies are dying in this county because there's only one NBU. All the babies in the counties are being referred to one NBU. You have an opportunity to change that by operationalizing this other NBU. And what you really just need from our assessment is hiring 8 additional nurses. Now we know for a strained health system, that's a big ask. But they were able to take this suggestion from the data that we analyzed and hire those 8 nurses and deploy them in NBU. 1 year later, what we saw is this NBU has now seen 363 babies. Some of these babies were referred from other facilities, and the survival rates of newborns has really improved in this county. So I think this story shows how we can use data first to tell a complete story, to advocate and actually tell them what's the impact of using data to make improvements. And from this story, we've been able to go back to the stakeholders at this facility and at the county level to tell them, look, when you look at the data and you see where the challenges are, then prioritize and make small investments. Actually, you could have impact. And that's sort of how I think about, to your question, that's sort of how I think about using data to complete the story and showcase the impact that data could have in improving the health system. I hope I have answered your question.
Perfect.
Yeah.
And remember, at the end of the day, these stakeholders are humans. Humans digest information in different ways. Some people are very analytical, and the data alone is enough for them to create the right story and understand where to take action. Some people need the story behind it, that narrative, to drive change. And so start by asking, who's the stakeholder? What is important to them? How can I create the most compelling case for change? And then how do I then use the data, the digital tools to enact that change? We are close to time, so I'm going to give you each one sentence. You have an incredible audience in the room, folks that are also at the bleeding edge of data, digital AI. What is the one learning you want to leave them with in one sentence from the great work that you have been doing?
Well, my understanding is that AI, chat responses, women empowerment are all together a very dynamic workspace. It is going to evolve, and it is going to be very, very different in 6 months. It is going to be very, very different in a year. And the idea is to keep absorbing this dynamism, build in dynamism into the solution is probably the way forward, where you don't have to reinvent the solution every few months or every few years. The solution itself should be capable of absorbing new evidence, should be capable of absorbing whatever new knowledge arises, and should be adaptive to the needs of the local community. That would be my message for them.
So it's a run-on sentence, but it's okay.
I'll leave you with 3 things: deep collaboration, seamless integration, and tailored stakeholder engagement. It is not a one-size-fits-all approach. You have to work with the women, you have to work with the health facilities, you have to work with the communities to create a very sustainable, scalable innovation for maternal health. Thank you.
Dynamism, sustainable solutions, engaging multiple voices. Sikander.
Yeah, mine is very simple. Let's build what lasts, not what looks good, because true impact comes in building simple digital solutions that can plug easily into the health system. Yeah.
Wonderful. Can everyone give a round of applause for our fantastic panelists? At this point in time, I'd like to invite Yaduni from the MSD for Mothers team for some closing remarks.
Natasha, and thank you to our wonderful panelists and to an engaging audience. I would like to share a few of my takeaways from this conversation. I think one thing I took away is that digital technology can be integrated meaningfully with the patients, the women, the providers, and at the system level, and that trust is a vital currency in healthcare, but more so in digital healthcare, where patients need to trust the information that they're receiving. They need to trust that their privacy is protected, and health system managers also need to be able to trust the data systems. And the third and final learning that I will be sharing is that collaboration, co-design, building systems together, however we put it, is vital. And what that means, it means staying agile, it means being intentional about failing forward, it means recognizing that you have different stakeholders across different levels, and however you slice it, you need to get their perspectives and work them into your solutions. So these are my takeaways, and this is really the call to action for everyone in this room to take this back and look at your solutions through these lenses. I want to say that this is just 3 coalitions of the Strengthening Systems for Safer Childbirth initiative. There are 3 others that are not here, but I want to create some curiosity. We're going to be launching our impact report on this very impressive coalition of a community of practice and group of coalitions. It's the Strengthening Systems for Safer Childbirth Impact Report. We'll be launching it next year, so please watch this space and you learn not just about these coalitions but others and how we're leveraging digital to advance healthcare for women across the world. Thank you so much.